Well, this pandemic changing just about everything in our daily lives.
That's for sure. We want to bring in Nicole Baker, who spoke today with an expert about the importance of mental health during this very difficult time. What did you learn, Nicole?
Hi, guys. Yeah, we spoke to Mike Silberman of Amethyst Recovery Centers. It's operating across 6 states, including here in Maryland. And one of the things we talked about was how our mental health is just as important as our physical health as we battle this pandemic right now. A lot of people thought that or hoped life would be back to normal by now, but that's not the case. So we wanted to get kind of some comfort for people right now who are not quite feeling themselves.
By having these trigger events, what we are seeing actually is more phone calls for people that are experiencing mental health and actually using and abusing alcohol more right now than they ever have been before.
I think that's a good point. This is a dangerous time for folks who maybe are already on the brink. We know before this pandemic hit, life was already happening. People were already dealing with stressors and bills or whatever it may be. And so this has probably made it worse in a lot of aspects. And for people who don't have the resources to reach out and talk to someone, I know that telehealth has been a huge tool and benefit in treating patients. Tell me how you guys are dealing with this influx in calls and how you all are still being able to treat patients. I know you're up and running across 6 states, including here in Maryland.
Yep, absolutely. So we've actually staffed up, and we feel very fortunate being in an essential business that's healthcare related, that we're not only not laying anybody off, but we're hiring right now. And we've been able to beef up our staff to be able to take those influx of phone calls. We've also added clinicians to the regiment. So if somebody calls in that just needs to talk, that just needs to have an ear, perhaps, they're not necessarily dealing with alcohol or drug abuse, but they're going through these stressors that they didn't really have before, we've opened the lines of communication up as well. So the clinicians, not only on site, but also in the contact center, are here to help those types of individuals. As far as telehealth is concerned, I am extremely grateful for our healthcare system, not only our employees here that stepped up to really research and identify how we could utilize this service, but I have to give credit, believe it or not, to the insurance companies, to Medicaid and medical assistants for really laxing their rules and guidelines during this crisis to where before some of these things would not be allowed as far as what they would consider to be normal services. And they've all lifted those guidelines in order to help facilities like ours and other places help and treat people out of their homes or who are quarantined to a sober home. So they can talk to the clinicians, to medical professionals via a Skype like we're doing right now and get the same types of services they would get if they were in person.
All right, as you heard Mike say, a lot of people who are already facing mental health challenges are now more at risk. So we can only say this so many times: go for a walk, go outside. But if you really need more than that, if you really need to talk to someone or you need a resource for any addiction you may be dealing with, you can go to Amethyst Recovery Center's website, because there you can set up a call, you can chat with someone online, and you can actually set up a time to talk to a clinician to kind of get the ball rolling on that treatment so that you have somewhere to turn when really you might be alone in the home and no one else to talk to.
Good
Denise
use of
and
the
Vic,
internet.
back to you.
Great.
Crucial information, Nicole. Thank you.